for the past 11 years, I've been working with Partners in Health, a very well-known international organization, both in Rwanda, in Liberia. I also worked briefly in Madagascar. And our work is just focusing on building health systems, pharmaceutical systems, and then ensuring sustainability, like to make sure that there's like the government has ownership to have strong systems, like ensure effective and safe use of health commodities. In addition to that, we realize there are gaps in pharmacy workforce development, where qualified pharmacists to serve in those settings, especially rural settings. And then not only that, but also other members of the pharmacy workforce, such as pharmacy technicians or dispensers, people who are dispensing pharmaceuticals. You realize there are gaps in this. They lack really knowledge and basic skills to ensure safe and effective use of medications. And then that's how I started early in my careers with Partners in Health. That's how I started like a training young pharmacists. We were collaborating with the University of Rwanda to mentor young pharmacists so that they can follow in our footsteps, but also asking them also to train the next generation. So that's how like I can really describe my interest in pharmacy workforce development. Then when I learned about Vennue as an organization that is really promoting pharmacy workforce development, that is really striving towards strong pharmacy workforce development in different parts of the world, I said, this is a perfect organization to work with because it's in line with my values. The work I do, like I'm mentoring the members of the pharmacy teams, but also I think I realized this was really a very good platform to work together to really advance pharmacy workforce development. And Vennue is unique because I've never seen a similar organization in the same perspective, focusing on pharmacy workforce development, especially in low-income countries. And then I have heard about other programs such as human resources for health. And I realized those programs, I remember they are also working in Rwanda. They focus on physicians, nurses, but they are not just focusing on pharmacists. And it's very important. And pharmacists are really key members of the health system. And in our settings here in low-income countries, we realize most of them are working in community or retail pharmacies where they really interact with the majority of the population. So they need to have like knowledge and skills, advanced knowledge and skills to really transmit the knowledge and skills to patients, but also ensuring that patients are really adhering to treatment. And then I realized Vennue is the right organization to work with. And I'm really excited and I look forward to working with Vennue for the rest of my life. That's what I could say.